In today's society, blood is one of the most precious resources in our healthcare system. Every day, countless patients rely on blood transfusions for surgeries, cancer treatments, chronic illnesses, or emergency accidents. However, around the world, the supply of blood remains critically insufficient. Statistics show that many countries face frequent blood shortages. Whenever there is a major traffic accident, a natural disaster, or an urgent operation, blood reserves can be depleted rapidly, putting patients' lives at great risk. There are many reasons behind this shortage. First, the willingness to donate blood is often low. Many people intend to donate, but are discouraged by complicated procedures, unclear information, or inconvenient scheduling. Second, the public's awareness of the long-term importance of blood donation is limited. Many only consider donating during times of crisis, while overlooking the need for a stable and consistent supply in daily healthcare. Moreover, existing blood donation management systems are often fragmented. Donors struggle to access up-to-date eligibility criteria, their donation history, or any recognition and rewards. As a result, many lack the motivation to continue donating regularly. Blood is not just a medical resource. It is the lifeline that connects and sustains humanity. A strong and resilient healthcare system must be supported by a steady and reliable supply of blood. Therefore, we need a new solution, one that makes blood donation more convenient, more intelligent, and more engaging. With this vision in mind, we introduce the Predictive Blood Donation Ecosystem. It is not just a technological platform, but a social solution designed to address the shortage of blood supply, encourage more people to donate regularly, and ultimately safeguard lives together. Good day, everyone. Our project is titled Predictive Blood Donation Ecosystem for Optimized Healthcare Resource Management. We are from Southern University College, and today we are excited to introduce our system to you. This project was carried out by 3 team members, Chong Wei Fong, Ao Jia Yi, and Ding Jin Yao. We would also like to extend our gratitude to our supervisors, Tis, Nur Shamila Binti Salamat, and Tis, So Yong K, for their continuous guidance and valuable advice throughout the project. In today's healthcare system, a consistent blood supply is absolutely essential. Blood plays a critical role in life-saving procedures, including surgeries, cancer treatment, and transfusions for patients who experience severe blood loss from accidents or trauma. Especially in hospitals and healthcare centers that rely heavily on blood transfusions, even a slight shortage can put patients' lives at risk. Therefore, maintaining a steady and reliable level of blood donations is not only important, but necessary to sustain public health and ensure that patients can always receive the treatment they need. However, despite the rising demand for blood supply, there are still many challenges in the current donation process. First, many potential donors face inconvenience during registration. Some struggle to find complete and clear eligibility criteria before they can donate. At present, there is no formal online platform that brings everything together in one place, such as registration, eligibility information, donor points or incentives, and blood donation history. This lack of integration often discourages people from donating. Moreover, research shows that people are often more willing to donate blood if they are rewarded with points or recognition. To address these issues, our study proposes a centralized, web-based platform for blood donation. This platform not only simplifies the process, but also explores how to attract donors to donate blood regularly, which is essential to maintaining a strong and healthy healthcare system. Our project has 3 main objectives. First, to identify and analyze the key factors and challenges in the existing blood donation procedures and applications. Second, to design and develop a centralized online platform that integrates all important information in one place, including donor registration, complete eligibility criteria, and a reward point system. Third, to evaluate the effectiveness of our proposed improvements through usability testing and by gathering feedback from real users. Together, these objectives aim to make blood donation more accessible, more engaging, and more sustainable. Here, we present the use case diagram of our system. The diagram shows the interaction between different users of the platform, such as blood donors, system administrators, and healthcare institutions. For example, donors can easily register, check their eligibility, view donation schedules, and monitor their donation history. Meanwhile, administrators and healthcare institutions can manage donor data, update eligibility information, and ensure that the overall blood donation process runs smoothly. This structured design helps us ensure that every stakeholder is connected through one ecosystem. Next, let us take a look at our user interface designs. We designed the platform to be simple, clear, and user-friendly. The home page allows users to register or log in quickly. The eligibility section provides complete and transparent information, so donors immediately know whether they are qualified to donate at a given time. We also implemented a reward system where donors can collect points each time they donate blood. These points can later be exchanged for recognition or rewards, encouraging long-term participation. Another feature is the Donation History and Prediction module. This allows users to track their past donations while also receiving predictions and reminders for when they will next be eligible to donate. By combining these features, our user interface not only improves convenience, but also motivates donors to stay engaged and return regularly. In conclusion, our project introduces a predictive blood donation ecosystem designed to optimize healthcare resource management. The platform integrates all essential functions, from registration and eligibility checking to reward points and donation tracking, into a single centralized system. We believe that by making the blood donation process more convenient and rewarding, this system will encourage more people to donate blood consistently. In turn, this will help hospitals and healthcare services maintain a stable blood supply, ultimately saving more lives. Thank you very much for your time and attention.